Thank you very much, Dr. Farid. That's been wonderful, and you made it so simple that most of us can now revise our biochemistry and understand a lot of cellular processes. I would. This is a part of the oration, so I would just. There is a citation. I'm just going to read it out to you before I give it to Dr. Venkatram to conclude the session. This is the Gargi Khanna oration for 2020 APFIC 12 Online Asia Pacific Vascular Society. Dr. Gargi Khanna oration for the year 2020 has been conferred on Dr. Professor Farid Murad, Nobel Laureate in Medicine from the United States of America, for his topic endothelial dysfunction in cardiovascular disease, discovery of nitric oxide and cyclic GMP signaling pathways, and application in drug development at the 12th Asia Pacific Vascular Intervention Course held virtually at New Delhi, India from 26th June to 30th June 2020. For his distinguished contribution to the field of science, Asia Pacific Vascular Society wishes him many more years of good health and academic excellence. Dated 27th day of June 2020. So,
well, thank you. I really appreciate it. I wish I could be there.
Yeah, we also wish the same, but we'll be sending it to you as soon as the courier service is open and the lockdown is eased out in Delhi. Delhi is undergoing a lot of issues right now. I think we are maximum in terms of number of new cases every day. And probably we are at the same stage where United States was there about 1.5 years back, 1.5.
Well, as you know, it's now increasing again in many of the states in the U.S., unfortunately. And I think we just opened things too prematurely, and too many crowds and groups, and it's transmitting the virus. About a dozen of the U.S. states in the past couple of days have had increased number of cases.
So over to you, Dr. Venkat.
Oh, it's a privilege to thank Dr. Farid Murad for his contribution to this wonderful program. Although this program is mainly for interventional cardiologists, but medical intervention is so important, and that is the vision of Dr. N.N. Khanna to include medical aspect as a part of interventional therapy, and having somebody like Farid Murad to give this splendid talk on the fundamental science of nitric oxide as the basis for cardiovascular disease and as a hope for cardiovascular therapeutics. And it has been my privilege to have known Dr. Murad for about more than 3 decades, and he came to India a few times. He came to Dallas when I was there, and this was just exemplary, and it's a very important talk on the fundamental basis of disease occurrence, progression, and how it can be reversed. And this very, very important in terms of early detection, prevention, and reversal of cardiovascular disease, which is happening during our own lifetime. So I offer my tribute and gratitude to Dr. Farid Murad. And then I also want to congratulate the vision of Dr. N.N. Khanna to include a Nobel laureate lecture in this program, which further enhances the tremendous caliber and value of his program that is so well respected all over the world. One more cap on his feather, and ultimate beneficiaries of what Dr. Khanna has done, Dr. Murad has done, the ultimate beneficiaries, of course, are all the patients that we see and their families. Again, on the behalf of the organizers, I want to thank Dr. Murad for his participation, although it's quite early, by the way, in California at this time.
It's okay, it's okay. I've trained 150 young people in my laboratory, and that's been fun because they teach me more than I teach them sometimes. And I think 4 or 5 of them have come from India, and they were very talented, did some very important work, and I'd love to have a couple more if they're interested in coming and working with me. Would enjoy doing that.
Sure, but Apollo will join you in this.
I visited Apollo about 6 months ago, and I was very impressed with what you're doing with Apollo. And while I was there, they showed me, I think it's your daughter who's the manager, and she showed me a picture of you. So I remember your face.
And thank you, Prabhu. That's my youngest daughter.
Youngest daughter?
Yeah,
She's very talented woman.
I'll tell her, but we would like to work in whatever way we can and make a difference for, for people.
Well, let's hope the virus goes away and I can come back and visit again.
That will be most welcome, but we look forward to that day.
Okay.
Any day that suits us will suit us.
Dr. Pratap Reddy Garu, Dr. Murad was kind enough to visit Apollo Hyderabad. And we do have a memorandum of understanding with him on developing new biomarkers for the early detection of cardiovascular disease. And it was going very well, but unfortunately under a pause. And Dr. Sangeeta Reddy Garu has been in touch with him, and will continue to collaborate to further fulfill your mission for early detection of cardiovascular disease.
Thank you. Thank you. I'll be very, very happy. I think this is what we can do for people. They depend on doctors, and I think doctors must continue to see what more we can do for people, especially new diseases.
Dr. Franvit, you have something to say?
Well, if there are questions, I could take a few questions. If there are questions, we can deal with that. It's your decision.
Dr. Veet, you are muted.
I'm muted? You can't
No,
hear me?
Dr. Veet, Dr. Frank Veet from Cleveland is muted.
Say that I enjoyed Dr. Murad's lecture. I fully understand it. And my comment is that his Nobel Prize was clearly one that was richly deserved. So I enjoyed this lecture, and congratulations, Dr. Murad. It was a great talk, and I understood almost all of it.
Okay. If you have young children and family, I've created a video that's also on the Nobel website. It's called "And a Winner Is," and I did it for young people to tell them about the Nobel Prize and get them excited about science. And I've showed it to 4-year-olds and 85 years old people, and they all seem to enjoy it because it's lay language and they understand it.
That's great. That's really great. Really enjoyed meeting you, sir, and enjoyed listening to you, and very provocative, understandable, and important.
You know, I'm sure you guys know that there are stents now with molecules on them to deliver nitric oxide. Some look interesting and maybe promising. I think there's been some difficulty with some of them, depending on how they're designed. But I think there could be local ways to administer agents that regulate nitric oxide production and activity. So it needs some good biomedical engineers to figure that out for us.
Dr. Murad, I think it brings me back to what we discussed, whether it is possible, like we are doing pudendal artery stenting for male erectile dysfunction. That's basically an endothelial disease, and if we can have some implants or a local delivery, prolonged local delivery mechanism to actually help these patients, because sometimes there are multifactorial issues, and in spite of good inflow, revascularization to establish inflow and also to cut down the outflow, they still have a lot of issues with EDs. So maybe the future would depend on some drug deliveries and localized deliveries of the drugs right to that site where these patients can be helped. I think it will be a combination of intervention and a good medical therapy which will be targeted.
I have developed some nutritional supplements to increase nitric oxide production with arginine and various antioxidants. I've also, in some patients taking these supplements, say that they are able now to have more erections or more frequent erections. I've also developed a topical product that I've used for wound healing. It accelerates wound healing. And some people have used it on the penis and say it can cause erections. So maybe there are ways to do this.
So, if there are no questions, thank you very much for joining us that early morning California. I really thank you, and you agreed to our request in a very short time. Thank you, Dr. Veet and Dr. Venkatram. And I thank and I feel blessed to have Dr. Pratap Reddy to chair this session, to bless this conference. And he, like a father figure, he sat throughout the lecture. And with his encouragement, we've been able to do unique works in the entire Apollo group. And he is the role model. And I don't think anybody in the country who wants to be a doctor or who is a doctor doesn't know him by his name or by his face or by his contributions. So,
Okay.
with the change of healthcare in the country.
A wonderful thing to bring the Nobel laureate.
Please say hello to your daughter for me, will you?
I will tell, and we want to work with you.
I hope I come back again soon.
Wonderful. We look forward for that. And any date is our date.
You look healthy. That's good. Be careful.
And,
Don't let that virus get you.
thank you. Thank you very much from all of us, from all cardiologists, and of course all the Apollo family. A big, big thank you, and just wonderful what you have done and what it will result for people. God bless.
Well, I hope some of the people I've trained can do more than I've done. That's the goal, right? It's like raising family. I want them to do very, very well, and I want to be proud of them, and I think I will. A couple of them have become presidents of universities. Many of them have become chairmen of departments all around the world. That's exciting. It's like raising family, and they teach me more than I teach them.
Thank you. That's a great appreciation from you, which is a blessing for them.
Thank you very much. So we close this session and move on to the last session of the day, which would be on venous interventions. And I would request the panel to join. And good night to all of you. Thank you very much.
Thank you.